All right, thank you for staying with Daybreak. Let's start that discussion right now in the ailing health sector. The strike is on. There was partial paralysis of medical services in some hospitals yesterday based on the spot check that was done by Citizen TV. KMPDU says the strike is on despite the court order. Let me introduce my guest one more time. Honorable Cynthia Muge is here, woman rep for Nandi County and also a member of the Health Committee. Thank you so much for making time. Honorable Ruben Kiborek, member of Parliament Mogotio and also a member of the Health Committee. Thank you very much for making time. Dr. Dennis Miskela, Deputy Secretary General KMPDU is here. Thank you so much for making time. And Dr. Abdi Ado Elmi, unposted medical intern. Thank you so much for making time as well. Let me start with you, Dr. Miskela. First of all, how is your Secretary General doing, Davji Atela? He was injured earlier on.
Thank you, Trevor. As all Kenyans know that the SG suffered injuries. He had a cracked skull and internal bleed. He has been HDU for 7 days. Then he was put out. He was to leave hospital, but he began having convulsions. So he's currently on anticonvulsants and other sedatives. But he continues to recover. We hope that he'll make a full recovery, although the doctors say that he should remain in bed rest for the next 6 weeks. Of course, we'll miss our captain, but there's no vacancy. As you can able see that the deputy has stepped up to do what my brother Davji would have done for me. Okay. Thank you. Thank you
for making time. Elmi, let me start with you on this. One of the biggest issues here is the posting of medical interns. You're an unposted medical intern. From your perspective, what really is the problem here?
For my take, I think the problem is mispriority by the Ministry of Health. Because as per the annual budget of the Ministry of Health, posting medical interns is just a drop in the ocean. So I don't think there is a reason why medical interns should stay outside for more than 8 months, others for more than 1 year, just wait for a compulsory requirement, which is the internship, to get their license to practice. Yeah. And you know, medical interns, these are qualified medical doctors. The only thing that is hindering them from practicing is the license. And the license, one will obtain the license after what? After the mandatory internship. And I don't think there is a reason why we should always waste these interns' time and the government has funds, or rather money, to post them.
This is exactly what the government says, that it doesn't have money to post interns. In fact, the CS for Health said that they had asked for money from Treasury, and Treasury indicated that maybe in the next 2 weeks they might get an additional 2 billion, but they're looking to get about 4.5 billion. So there's, according to the government, there's no money. Do you buy that argument?
I really don't buy that idea. Where does the government get funds to do the affordable housing program, and it doesn't have funds to post interns? And remember, interns are like the 30% of healthcare workers, and all like the level 3, 4, 5. Most of the patients, they encounter the first person who is in line of duty is the intern. They will always find the interns there. So why should we have funds for affordable housing program and we can't have funds for the interns? And remember, you cannot stay in an affordable housing program if you are not healthy.
Okay.
Yeah.
Dr. Miskela, there's a court order giving stay orders for this strike. So is this strike on or off based on the court order?
Thank you, Trevor. As a union, we are a respecter of court orders. We are respecters of the rule of law, unlike the employer. The employers who now have 3 contempts of court. The first one in form of the CBA that themselves they deposited in court as a court order. They didn't implement. Come October 2021, they had a court order to implement in 60 days and give a report. They did not. And finally, the court order that went to pursue around the housing levy, which was ruled illegal, and they continue to deduct. So the employer has 3 contempts that they need to purge before they attempt to come to the table of equity to seek any form of justice. And as KMPDU, we keep on telling them that you cannot come to the table until you wash your hands off that contempt. As a union, we have no intention to contempt the court, because we know that it's the law that finally separates us when we disagree. Yeah? The only challenge that happened is that there is something called the minimum service agreement that the court also 2 years ago ordered the government and the union to sit down and agree on. When we go on strike, the intention should never be to make patients suffer or die. So we were supposed to have an agreement on how to give life-saving services while not compromising the quality of the strike or its success. We gave the government proposals 2 years ago. They refused to negotiate on the minimum service agreement. The same KNH that went to court yesterday, in the CBA they have refused to sign. There's a part on the minimum service agreement. Because for us as KMPDU, I repeat again, the success of our strike is not about how many women die. It's not about how many children suffer. It's about, does the employer listen and come sit down? So yesterday we spent the whole day, as the court ordered, to sit down and engage on the minimum service agreement. And I'm happy to note that there's a report being tabled in court today, as the court ordered, on what we can do to help. Because I don't think that those poor women and children have anything to do with the government refusing to implement 3 court orders.
Okay. Honorable Muge, the KMPDU officials and the medical interns say that there's misplaced priority from the health sector. Do you agree, and do you support their industrial action?
Well, thank you, Trevor, for having me this morning for this particular discussion on health matters. Like you properly put, I am a member of the health committee, and of course I have a lot of interest like everyone else in the health sector. First, Trevor, I am surprised that Dr. Abdi is asking, of course, on the matter of priority, is asking where the government is getting money for affordable housing. Of course, affordable housing is not up for discussion here. But if you look at what the KMPDU is asking for, one of the matters is we do not subscribe to affordable housing. So I don't think Dr. Abdi is actually in the right place to ask where the government is getting affordable housing money, whereas it's not getting health money. One, the reason why the government is actually asking people to contribute to affordable housing is because there's no money. So I think courtesy or on the basis of his argument of putting or using the affordable housing as an example, it looks like we agree that there's no money. That's why the government is asking people to contribute towards the housing project. However, Trevor, we cannot also blanketly say we don't have priority, or rather, we don't prioritize health care issues. It would be prudent to note that healthcare, especially in this government, is the second highest funded. And in the counties where I've worked before, it was the highest funded. And you know, Trevor, health has been devolved to the counties. So whatever amount of money, which is in billions, that goes to the counties, the greatest percentage goes to health. So it is not factual, Trevor, to say that this government does not prioritize or support healthcare issues and matters for that matter. It is one of the agendas of this government that has pillars. And one of the pillars is actually the human resource for health, which is a living pillar, so to speak, that's supposed to help spearhead and ensure that the Kenyans are able to get universal healthcare. So basically, it is not factual that healthcare is not prioritized. We can speak about other issues and small teething problems here and there, which is normal, but we cannot blatantly and blanketly say it is not prioritized. Hell yes, it's prioritized.
Okay. Do you support the industrial action?
Well, there are issues that they are raising that I personally support, including better working environment. You know, it's basic for everyone that they get better working environment. But Trevor, there are also issues that I don't support in their industrial action, and a lot of them for that matter. Because one, on the internship issue, if you have looked, Trevor, if there are people who are very well remunerated, even when they are on internship, is the medics. The medical doctors. Of course, it's discriminatory, and I hope to hear from the Deputy Secretary General why we only have the doctors, the MOs, the dentists, pharmacists, nurses, and CEOs, and not the lab technologists, not the public health officers, not the therapists, and other cadres, because healthcare is a whole list of categories of people who work there, including even the cleaners. So first, this particular body, and I hope to listen from the representative here, is discriminatory in itself. The internship issue, and I tend to think, Trevor, the internship issue is, I don't know what exactly is their problem or what exactly is their complaint, because I don't feel like the internship posting, now that we have Dr. Abdi here, we say the unposted doctor intern, I don't think that is the main problem, because really we have a very good number of people who are guaranteed of internship, and they're only medics. Other people, like the physical planner in me, I clear my 4th year in urban and regional planning at the University of Nairobi, and I go out there and fend for myself. Like, you find a place to intern on your own. The medics, Trevor, they finish, they cross their hands, and they wait for the government to post them as interns for them to be licensed in the end.
And get paid.
And of course, they get paid. I love good money. Dr. Abdi can tell you that that's what he's waiting for. They get good money. And you see, public service recently posted or advertised for interns. They were paying 15,000 shillings for diplomas and I think 25 for degrees. Do you know what the medics get for the same in all the cadres that are actually given the paid internship? Up to 206,000 shillings. Trevor, I wish I was a doctor.
Okay.
Yeah.
All right, let me bring in Kiborek on this. Kiborek, do you support the industrial action, first of all?
Thank you, Trevor. First of all, I want to pass my quick recovery message to Dafji, my friend, before we start the show. And we call upon the government to investigate. You know, these unionists, their politics is more cruel than that one of us politicians. It could be inside job.
How could you an inside job?
The government, you know, the union politics is more cruel and more tougher. We don't have Muchai up to date. The Honorable Muchai Fokabet, he was a unionist. Even Tom Mboya was a unionist. So union politics is more cruel and it's more lethal. Maybe, you know, position adjusting here and there. So we want the government to investigate because we don't believe government can harm Davji. He's a harmless guy. So industrial action is a yes and no answer in the sense that my wish is that in the next 1 year or so, we'll sit here with Dennis and Abdi and discuss the quality of service in our hospitals and our dispensaries and our health care system. It is a worthy discussion to discuss. More than this one we are discussing should be how is the experience? What is the quality of health service do we have in our nation? So that we discuss, it affects the patient, it affects the doctor, it affects everyone in the environment. So the discussion, in my view, should be on the quality of service we get in our hospitals and our dispensaries. But nonetheless, from where they are sitting, and from me and Cynthia where we are sitting, is they look at things from different perspectives from that we look from. Because as we sit in the health committee, we do budget for the health department. And first we start with budget policy statement where we look at the ceilings. What are our projections? How much can we raise in terms of our revenue, collected revenue? How much can we raise in terms of our grants? How much can we raise in terms of maybe loans and borrowing? So that we're able to allocate money as per what we have as a nation. You know, as much as they want money, there's a source of that money, which maybe it could be revenue, it could be grants, it could be A&A in their hospitals, it could be maybe in loans form. So every ministry is giving ceiling of the money they should budget for. 2023-2024, we sat as a health committee. We budgeted 3.7 billion into the interns program. But now they want 4.8 billion, if I'm not wrong, almost close to 4.8 to be able to cover as they want. Now the issue is we have a policy problem in terms of handling interns, especially in the medic center. These are students who have come from Ministry of Health getting loans and they are transited to Ministry of Health. When they come to Ministry of Health, they are not employees of the ministry to begin with. For lack of better words, they are not employees of the ministries, but now they are students. We should be in a continuing program of learning from Ministry of Education. The policy framework in terms of dealing with these interns is not well elaborated. There's a loophole. This number has been increasing for the last 10 years. Since 2013, when it started, there were 254 interns. Now it is 6,000. It's about 6,765 interns that we have across the nation. About 6,000, 7,000, almost 7,000. It is growing every time because many universities are offering more intern courses, more medical courses. Our KMTCs, our 10 universities, our private universities are offering medical courses. So the number continue ballooning. So in terms of even when you are sitting and doing the budget, you don't have the figures right because it is in the other Department of Education. Because at that time you are doing budget, they are still students. And we are making my budget in the Ministry of Health. And the data is still with the Ministry of Education. It is not regulated that how many numbers of doctors do we have in this country that we should have let's say in a year. So every school offers courses, they do their marketing, they get the students, they get quality education, they graduate. They are now disposed to the Ministry of Health, which they don't have the numbers. The number were with the Ministry of Education and HELP, which has been taking care of these students. Now we have to make budget based on assumption that this year should be around 6,000, around 5,000. It changes, it fluctuates. There's a year which goes up, another year comes down. Now, to make budget become a bit difficult, because these are the people from another ministry, the budget is being done by another ministry. Now when we sit here in the Ministry of Health doing our budget, these doctors, these interns, doctors because they are doctors, do not serve in the Ministry of Health. They serve in our hospitals and in our county hospitals, either referral or level 5, level 4 hospitals in the counties. Counties are given the equitable revenue share, but they don't pay these interns. But they get free labor from the Ministry of Health. That these interns who are doctors and they treat and they are doctors, but they have posted to county hospitals, which this county should be hiring them, those who graduated before. But they don't want to hire them because they get free labor, which is disposed to them from the Ministry of Health. They freeze they stop hiring more doctors because they know interns will be posted and they will work as doctors and they'll do this. Two, when we are doing budget, every referral, the only sagas we have as the national government is the referrals. They come to defend their budget. More referral come defend their budget. We want this money. Kenyatta Hospital come defend their budget. We want this billion for hiring, for our enumeration, for our blah blah. The KUTRH, the other hospitals come to defend their budget. But now this one are left with the Ministry of Health. But the consumers are these sagas. So to me, the issue should go back to the CPS that they have signed. That assuming they had a good CBA with Moi Teaching and Referral, they couldn't want to ask their interns in Moi Teaching and Referral to boycott work or to strike because they are already taking care as part of them. Terms agreed with the Moi MTRH in Eldoret or with the Kenyatta University Teaching and Referral. But now they are all lumps up in a one ministry called Ministry of Health. Who are not the consumers. The consumers are the referral hospitals, which they have their A&A in terms of collecting the revenue at source. When you go to the hospital, they collect the revenue at source, they defend their budget, but they don't bring the budget of these interns to the parliament when they are doing. The ministry does. The ministry has more bigger role to take care of the entire health system from MES, called medical equipment services, and all other priorities. So to me, the problem goes down to the policy. And we have to agree because I believe my brother Dennis here did not come here to look for who to blame. It is to look for solution. Okay. So if we are to look for solution, let me finish. Just write down if we are to look for a solution, Dennis, we have to come with a policy which take care of these interns. And as my sister Cynthia says here, these interns, when they are brought to government, they're not given small money. They are given job group L. And job group L, according to SRC for doctors, the basic salary is about 44,000. To be honest, and lack of better ones. But plus the allowance, it comes to about 206,000 per one. Now you have about 6,000 or 7,000. We have a constraint in terms of our fiscal space as a nation. We have to agree with that one. So the more we put pressure, we are putting pressure to a fiscal space which is already under pressure. So to me, from where I sit, Dennis and the team should be calling the parliament and the Ministry of Health and the Ministry of Education because these are their people.
Okay. All right. Interesting views.
Because what I'm saying, the Ministry of Education is because we should take some budget a bit from the Ministry of Education to be able to be moved to the Ministry of Health so that take care of this postgraduate education because actually they're still in education, but they are in the education, work-based education.
Ms. Gall, I'll give you a chance to respond, but Elmi was mentioned adversely. What is your complaint as interns? Whereas she was saying that her, as a planning officer, when she's done with school, she finds her own internship. Okay. You guys just sit back and wait to be posted and paid 200,000 shillings.
Trevor, that's not true, and I'm honestly disappointed by the woman rep. First, you can't compare an intern who is an urban planner to a medical intern. Do these politicians really know who a medical intern is?
You're here, so what is a medical intern?
And that's why I'm here, to at least educate them on this. First, our struggle begins way back in high school. how we burnt the midnight oil to acquire the grades and the higher cutoff points. Can you compare first the cutoff points of a MBCHB and urban planning? That's one. As per CUSPs, the highest cutoff points is for dental, then MBCHB, which is roughly 44 point and above. And that's an A- clean A. The minimum subject is a B+. What's the minimum required for an urban planner? That's the first thing. It starts from high school. Then number 2, after we acquire these grades, we are called to a university. Number 2, Mheshimiwa Ruben said we get loans from the Ministry of Health. Which loans? Most of these people are self-sponsored students. They were sponsoring the education. And training a medical doctor, by the way, it's very expensive. Roughly costs 3 million up to 5 million with the different universities. Another thing, they said that a medical intern is just like a student who is furthering his studies. That's not true. We are fully trained doctors. The only thing that is stopping us from doing our training is this internship, because we don't have license. If at all they can say that we are supposed to look for internship for ourselves, I think they really don't know who a medical intern is. Something else, again, Trevor, Mheshimiwa said that the urban planners and the other interns, they look for these programs for themselves. I've said we study for 6 years. It's extremely strenuous to train a medical doctor because it's very expensive. And another thing, Mheshimiwa said that she wishes she was a doctor. Can she really work for that 6 hours continuously? That's food for thought.
Trevor, I think it's tragic.
Yeah.
Listening to the MPs in the health committee on, first of all, their ignorance on the facts of the matter currently, and their lackadaisical way of the approach. First of all, when did the rain start beating us? Once you understand that, then you'll know where we are. Internship has always been in this country ever since medical training was in this country. 1. 2, you cannot tell somebody who has been in school for 7 years that they cannot practice anywhere until they get internship. Look at lawyers. You don't have to go to KSL for the diploma to become a lawyer. If you don't go there, you can still become a lawyer without going to the advocate of the High Court. They have an option out. These interns have no option out. You are tied there. You can't do anything. And if you do it, either you'll kill patients because you don't have the supervision, or you'll be arrested. So you tie these hands. They can't move forward or backwards. 2, on the numbers. Even if we employed every single doctor who graduated in this country for the next 55 years, there won't be enough numbers. We have only 5,600 doctors working against 55 million Kenyans. So for you to even just come close to the 1 to 1,000 ratio, you need to absorb the 1,000 who graduate every year for the next 55 years and assume that none dies, none retires, none leaves. So the numbers are still very, very low. They're not 6,000, mark you. There are only 1,000 doctors graduate. The 1,200 we have now is because there was a backlog of 1 year. If we absorb them every year, we will not be having that number ballooning. And even the July, they're telling us to wait. Another batch will come and the number will get higher.
Exactly.
But with the internship policy, Ministry of Health has a slot of 9,500 interns, which that's a staff establishment from PSC on internship. Even if you took all the interns, all the medical interns, they come to around 4,000. You have a ceiling of 5,500 untouched. So there's nothing like an increased number. Our hospitals still grapple with shortages. And how do you know that you have a shortage? Which is plugged by these interns who fill up 30% of that workforce. When that woman wakes up in the morning and goes to Kenyatta and she stays the whole day, she's a woman rep, she'll tell you. That's the shortage. One doctor is seeing 200, 300 patients. She wakes up one day that will I go and do the mama for a job to feed the other children, or will I take this child who has fever to Kenyatta and spend the whole day and lose my money and earnings for the day? She goes for the job, comes back, the baby is dead. She goes to the hospital the whole day, the children starve. That's a struggle every woman suffers in this country. When you have a woman whose teenage daughter has TB somewhere in JTRH in Kisumu. And she's being told that since you only have 2 nurses on duty, you have to stay behind and watch your sick child, feed her, and give her drugs. You're like, whom will I leave with those children back at home in Manyata Estate as I come to be with this sick one in the hospital? Because there are not enough nurses to be there. When you have mothers dying in Mama Lucy because there are 2 nurses seeing 40 women in labor, the nurse is like, do I sort the one who has delivered and might bleed, or the one who is in labor delivering, or the one who is supposed to go to theater complicating? When she finally dies, the governor comes, fires the board, fires the maid soup, but does not employ or increase the numbers. That is what the shortages are about. And that's the shortage that the interns plug every single day. So that when 1,000 of them left in January and no new ones have come in, the system is struggling. Secondly, on the pay issue, I have to discuss about the pay issue. Internship is not like where you're in a hostel somewhere with a HELB loan and you are living in a cheap accommodation. No. These young men and women, they randomly ballot and get where they're posted. You can be coming from Mbita and then you're sent to Baringo where Kiborek Honorable comes from. You have to first of all get housing there, how you feed yourself, how you take care of yourself in that far-flung place. So in January, the CS tells them you'll go in February. Early February, she says she will go in February. They go book houses, get houses, pay deposits, take loans, life is started. They tell their people, give me money, I'll pay you back end of March. March comes, all of a sudden there's no money. And the committee tells you that the problem is the intern and the union. Not somebody you knew very well from medical school, that we have X number of doctors graduating every year, and they have an establishment of 9,500. Only 1,000 of them came out. So whose problem is this? That's the interns, that the money somehow disappeared. And I agree with him on priority. The budget for healthcare is not the most budgeted for function. Number one is education at 600 billion. In fact, if you analyze the budget, healthcare comes down.
Number two.
No.
Number two.
Security is more than health. I can tell you that for free.
No.
Yeah? I can tell you that even the money spent on the doctors, let me just make it even easier for them. The budget for last year on the health was around 143 billion. And healthcare
Trevor.
is, no, let me finish. You'll get your point. Healthcare is 90% devolved. Only 65% of the functions stay in MOH, which are what? Policy and training. Policies that they make, like the internship policy that I have here, which they don't follow. If they don't follow the policy, how will they make the counties to follow them? Secondly, training, that they don't pay for people even in master's training. They don't do that. They tell you, oh, it is in MOE. What stops the committee from getting the money from MOE to MOH? Don't come crying to me as a parliamentarian.
Yeah.
If they're not complaining, what will I do? You get that? But more importantly, that we have a CBA. That is very, very clear. And I'll tell you the history of this CBA on internship. In 2013, we have a CBA that the government disowned. That the PS who signed it was a stranger, Mark Bor. And the 100-day strike in 2017, I don't know where they were, but I know that I was the union as a leader. We went to strike for 100 days, forcing them that these signatures were your own PSS signatures. Implement, they refused. And forced us to sign a new CBA after 100 days of pain and suffering for Kenyans and the doctors. 6 of us were jailed then. When there was a stalemate around the internship policy, only unlocked by the president, because the same argument came back and forth. Treasury then gave the approval for SSC finally to allow this thing to be registered. And who registered this thing in court? The Minister of Health lawyers carried this thing and told the judge that adopt it. We have agreed as a court order to compel everybody to implement it. They have never implemented it, and now they're telling you this thing is clear on the policy that after the CBA, there's the internship policy 2019. That the same government sat down and made and said that every 30 days after graduation, we'll be posting them, and they'll be earning according to Job Group L. Now they're telling you all of a sudden mid-game that no. We have to change the rules. Oh, there's a problem here, there's a problem there. No. You're not going to change the rules because a CBA can only be reviewed progressively.
Okay.
And any attempt to reduce the benefits of interns backward will be met with the resistance that it deserves.
Okay. I will take a break. I know you have something to say. I will take a quick break and then the members of parliament will also come in. There's a lot of feedback also coming. Let's take a quick commercial break, come back with the feedback, then continue the discussion, right? See you in a bit.